Alright, so coming off the heart, we have the superior vena cava, and on either side you're going to have the brachiocephalic vein. So this is the right brachiocephalic vein and the left brachiocephalic vein. And then the next ones you'll see right here are the internal jugular veins, and then just lateral to both of those are the vertebral veins. And then on this side, you'll notice this one is the external jugular vein. If we go up the internal jugular vein, we have the facial vein right here and the temporal vein coming off of that. And then off of the external jugular vein, we have the occipital vein that drains out there. Now moving past the brachiocephalic, past the internal jugular vein, the vertebral jugular vein, or the vertebral vein and the external jugular vein, from here to here before it branches is the right subclavian. So this is the right subclavian vein, and then it's going to branch off into two veins. So running all the way down the arm is going to be the cephalic vein, so that will run all the way down. And then it branches off into the axillary vein, which is from here to here. And then once it branches again, this axillary vein is going to branch into the basilic vein, which is going to run all the way down the arm as well, and the brachial vein. So this section right here, when it splits again, we'll call this the BBC, or the basilic, brachial, and cephalic. Then we get to this next network right here, and the cephalic is going to continue down, so this is still called the cephalic, but meeting right here towards the middle is going to be the median cubital, and then the brachial is going to split into the ulnar vein and the radial vein. And this, if you remember, is the cephalic vein. So if we use the word crub, we can memorize which order these go in from lateral to medial. So crub, so cephalic, radial, ulnar, and basilic right here. And then just like the arteries, you have your palmar arch vein and your digital veins. Alright, so let's go back up here. So we have your superior vena cava, and then you're going to go down your inferior vena cava, and we're going to follow that all the way down to the external, or the lower extremities. So you have your inferior vena cava that's going to split off into the common iliac veins right here, and then the common iliac veins are going to split again into the internal iliac veins and the external iliac veins on either side. Now following the external iliac vein, it goes all the way down until it branches right here, and it branches off into the great saphenous vein, which is going to follow the leg all the way down to the bottom. So this is the great saphenous vein. It's the biggest vein or longest vein that we have in our body. And then once it branches off right here, it's going to branch into the femoral vein, which runs right here. And then on the back side is your deep femoral vein. So it branches off of the femoral vein to the deep femoral vein back here. Now once it splits, once you get to your kneecap, once it splits again from here to here, the femoral vein is going to turn into the popliteal vein. So here's your popliteal. And then branching off of the femoral vein, you're going to have your small saphenous vein that's going to run along the outside of the vein right here. And then coming off of the popliteal vein right here, you're going to have your anterior tibial vein. And then right behind that right here is your posterior tibial vein. And then on your most lateral side right here is going to be your peroneal or fibular vein. Now running along your anterior tibial and your posterior tibial is going to run down the underside of the foot, and that's going to be your plantar arch vein. And then your great saphenous vein and your small saphenous vein are going to go to your dorsal arch veins right here. Now let's go back up to the internal and external iliac. That's going to go to your common iliac, which is going to go to your inferior vena cava. And we'll look at some of the things that are right here. So you can see going to your kidneys on either side, these are going to be your renal veins. Now coming off of your left renal vein, you have your left gonadal vein that comes off of there, and then your right gonadal vein is going to come off of your inferior vena cava. Now, just like your arteries, this is going to be your superior mesenteric vein, and then running along right here is your inferior mesenteric. So you can see that this is superior, it starts off more superiorly, it comes to the front, and this is inferior mesenteric. Now, branching off this way, going towards your spleen is your splenic vein. So your superior, your inferior, and your splenic vein all converge into the hepatic portal vein that's going to go to your liver, and that is number 48 right there, and that's going to go straight up there. And that's going to go to your liver. Now your liver has a vein that goes to the inferior vena cava, and we can see that on the backside right here. So this is the hepatic vein, and this is the inferior vena cava. Now the other things that we can see on this model are, are also on the backside. So coming off of the superior vena cava, we have your intercostal vein right here, and then right below that you have your azygos right here, and then branching off along the thoracic aorta right here is your hemizygos vein. And I think that's it.